Hey everyone, and welcome to another deep dive. You know, we love to do these for all you future nurses out there.
You're about to hit the ward soon, so we thought we'd tackle something you'll be seeing a lot of.
And that is upper respiratory tract infections.
Yep.
Those pesky URTIs.
We'll be going way beyond the textbooks today, bringing in some of those real-world nuances.
Think of this as your URTI cheat sheet.
Ah,
From the common cold to, say, peritonsillar abscess.
oh yeah, that's a good one. And speaking of things that'll make you go, uh-oh, did you know untreated strep throat
Can lead to
can sometimes lead to rheumatic fever?
rheumatic fever. No, I thought that was something from, like, history books.
It's definitely not. It can still happen. Because the antibodies our bodies make to fight those strep bacteria can sometimes mistakenly attack heart valves as well.
So it's not just the bacteria themselves, but our own immune response can kind of backfire.
Exactly.
Okay, that's definitely something I'll be watching out for during those patient assessments.
Absolutely.
So let's break down these URTIs. Where do we even begin?
Well, let's start with the anatomy. When we're talking about URTIs, we're talking about infections affecting the upper respiratory tract.
Okay.
So that's your nose, sinuses, pharynx, and larynx.
And are viruses the usual culprits here? I know bacteria can play a role, but...
Yeah, viruses are definitely the most common, especially for things like the common cold.
Okay.
But bacteria can get involved, for sure,
Yes.
sometimes leading to those more serious complications we mentioned.
Got it. So in the clinical setting, what are some of the most common URTIs we'll be seeing?
Well, you'll see a lot of rhinitis, pharyngitis tonsillitis, and as we mentioned, that dreaded peritonsillar abscess.
Yep.
And of course, laryngitis, which can be a challenge for us nurses. You know, we rely on our voices.
Oh, tell me about it. One time after clinicals, I totally lost my voice from talking all day long.
Oh, yeah, I've been there. It's an occupational hazard for sure.
Definitely. So let's start with rhinitis. It's more than just a stuffy nose, right?
Right. It's more than just that stuffy nose.
Now, I remember learning about allergic and non-allergic rhinitis. What are the key differences again?
So allergic rhinitis is triggered by an immune response to allergens like pollen dust mites pet dander.
Right.
Your body releases histamine, which leads to inflammation, and all those classic symptoms, sneezing, runny nose, congestion.
Oh, yeah. I know those all too well.
Yeah.
So it's not just the allergen itself, but our body's overreaction to it.
That's it. Exactly.
Okay, what about non-allergic rhinitis?
With non-allergic rhinitis, you get similar symptoms, but the trigger isn't an allergic reaction.
Okay.
It could be something like smoke, strong odors, changes in temperature, even
Yeah.
some medications.
Interesting. So as nurses, we need to really get a good patient history to figure out the cause.
100%. Is it seasonal? Does it
Yeah.
happen all year round? What makes it better or worse? These are all important clues.
Okay, good points.
Yeah.
And it's kind of fascinating to me that allergic rhinitis is on the rise.
It is. It really is.
Like, why is that happening?
Well, there are a few theories. Pollution definitely plays a role. And thanks to climate change, we're seeing longer pollen seasons in many areas. Ugh. That's a bummer. So how can we as nurses help patients manage their rhinitis? Especially when it comes to those allergies.
Education is key. We can teach patients about their specific triggers and how to avoid them.
Okay.
Think HEPA filters. Dust mite covers nasal irrigation.
Speaking of nasal irrigation, what about those neti pots? Are those actually helpful?
They can be, but it's super important to use them correctly with sterile water.
Right.
So you don't introduce bacteria into the sinuses. We can actually demonstrate the right technique for patients.
Okay, good to know. So we've covered the basics of rhinitis. Now what about pharyngitis?
So pharyngitis,
Yeah.
or sore throat, is another super common URTI. As nursing students, you'll need to quickly learn how to differentiate between the viral and bacterial causes.
Right, because that determines if we need antibiotics or not. But how do we tell the difference?
Well, most sore throats are viral and will resolve on their own.
Okay.
But with bacterial pharyngitis,
Yeah.
especially strep throat,
Caused by?
caused by group A streptococcus, we need to be more cautious because of those potential complications. We talked about rheumatic fever earlier, but are there any other serious complications from strep throat we should be aware of?
Absolutely. Untreated strep can lead to things like scarlet fever,
Oh, yeah.
which causes that very distinctive rash, and post-streptococcal glomerulonephritis, which affects the kidneys.
Okay, so that's why we need to be on the lookout for those signs of strep. What should we be looking for during our assessments?
Ask about the onset and severity of symptoms. Look for white patches on the tonsils, swollen lymph nodes, and fever. And, of course, a rapid strep test or throat culture will confirm the diagnosis.
Yeah, I remember learning about those rapid strep tests in class.
They're
But are they always accurate?
pretty good. but not foolproof.
Okay.
Sometimes a throat culture is needed to confirm, and even if the rapid test is negative, but the patient has all the classic symptoms, we might still treat for strep just to be safe.
That makes sense. Now, what about tonsillitis? The tonsils are part of the lymphatic system. What causes them to become inflamed?
So tonsillitis, like pharyngitis, can be caused by either viruses or bacteria. And again, the bacterial form, especially strep, tends to be more severe.
So we need to be just as vigilant about recognizing the signs of bacterial tonsillitis.
Yeah.
Besides the pain and discomfort, what are some of the complications we should be watching out for?
Well, one concern is airway obstruction.
Okay.
Swollen tonsils can make it difficult to breathe, especially in children.
Right. I remember learning that obstructive sleep apnea, or OSA, can be a complication of enlarged tonsils.
Exactly. And then there's the risk of a peritonsillar abscess, which, as we mentioned, is a serious complication that needs prompt intervention.
Okay, let's talk more about peritonsillar abscess. It sounds pretty scary.
It can be.
Right.
So imagine this. You have tonsillitis, but it doesn't get treated properly.
Okay.
Or maybe the bacteria become resistant to those initial antibiotics.
Wow.
And the infection spreads beyond the tonsils, forming a pocket of pus between the tonsil and the surrounding tissue.
Yikes.
That's your peritonsillar abscess.
Ouch, that sounds so painful. What kind of signs and symptoms would we see with that?
So the patient will have a severe sore throat, usually worse on one side. They might have fever, drooling because it hurts to swallow, and their voice might sound muffled.
Oh, yeah. I remember learning about that hot potato voice. But how do we tell the difference between that and regular tonsillitis?
It can be tricky. But with a peritonsillar abscess, you might also see that the uvula...
That little dangly thing in the back of the throat.
Yes, the little dangly thing is pushed to one side because of the swelling.
Right.
And the patient might have trismus, which means they're having difficulty opening their mouth.
Oh, wow. Those are definite red flags. So if we see that, what should we do?
This is a medical emergency. The abscess needs to be drained, and the patient will need IV antibiotics.
So this is a situation where we need to act fast and advocate for our patients.
Exactly.
Okay, now what about laryngitis? Is that always caused by a virus?
Viral infections are definitely the most common cause, usually after a cold or the flu.
Okay.
But it can also be caused by overuse or misuse of your voice, exposure to irritants like smoke, and even acid reflux.
So singers, teachers, and, well, nurses are all at risk then. What are some key things we should keep in mind when caring for patients with laryngitis?
The most important thing is voice rest.
Oh, no.
I know it's tough for nurses, but even whispering can strain those vocal cords and delay healing.
Okay.
We need to encourage patients to use other ways to communicate, like writing things down or using gestures.
Right. And hydration is important too.
Yes, absolutely. Drinking plenty of fluids helps to soothe those irritated vocal cords.
What about medications? Are there any specific treatments for laryngitis?
For viral laryngitis, it's mostly about supportive care. Over-the-counter pain relievers can help with discomfort, and throat lozenges can soothe the throat.
And what about for those more severe or persistent cases?
Sometimes doctors will prescribe corticosteroids to reduce inflammation, especially for people who need their voices back quickly.
Like podcast hosts.
Exactly, like podcast hosts.
Good to know. But wouldn't it be better to just prevent laryngitis in the first place?
Absolutely. We can teach patients about good vocal hygiene, like avoiding overuse, staying hydrated, and using proper voice techniques.
So we've covered the basics of these common URTIs. But as nurses, we also need to be prepared for those situations where things take a turn for the worse.
That's where things get really interesting and potentially scary. Because even though URTIs are common, they can lead to some unexpected and serious complications.
Uh-oh.
Yeah.
Okay.
Okay.
Welcome back to our deep dive on URTIs. Before we get to those uh-oh moments, I want to pick up where we left off, talking about those potential complications. Even though URTIs are so common, things can take an unexpected turn.
Absolutely. And that's where your nursing skills come in. You need to be vigilant, connect the dots, advocate for your patients.
So let's talk about those complications with rhinitis. It seems like the main concern is it can progress to something more serious.
Yeah, untreated or poorly managed rhinitis can lead to sinusitis,
Sinusitis.
where those sinuses get inflamed and infected. We're talking facial pain, pressure, sometimes even fever.
And sinusitis can be caused by viruses and bacteria, right?
You got it. Viral sinusitis often clears up on its own.
Okay.
But bacterial sinusitis might require antibiotics. As nurses, you'll be watching for those red flags,
Like
worsening symptoms, fever that doesn't break, and thick discolored nasal discharge.
Got it. So sinusitis is something to watch out for. Are there any other potential complications of rhinitis we should be aware of?
It can also make asthma symptoms worse.
Oh, yeah.
If someone with asthma has a bad bout of rhinitis, it can trigger wheezing and difficulty breathing.
That makes sense. Inflammation in the upper airways can definitely impact the lower airways as well.
Yeah.
Now, what about pharyngitis? We've already talked about rheumatic fever, scarlet fever, glomerulonephritis.
Right.
Are there any other complications?
Well, one concern is an abscess,
An abscess.
but not the paratonsillar abscess we talked about before.
Okay.
Pharyngitis can sometimes lead to a retropharyngeal abscess,
A retropharyngeal.
which is a collection of pus in the back of the throat, behind the pharynx.
Oh, wow. That sounds just as serious as a paratonsillar abscess. How would we even recognize that?
So the patient might have a stiff neck, difficulty swallowing, drooling, and a muffled voice.
Okay.
It can also cause breathing problems, especially in young children.
Those symptoms sound similar to a paratonsillar abscess.
Mm.
How do we tell the difference?
It can be tricky, but with a retropharyngeal abscess, you might see swelling in the back of the throat during the exam,
Okay.
and an X-ray or CT scan can help confirm the diagnosis.
So imaging studies might be needed, and I'm assuming the treatment is similar to a paratonsillar abscess.
Exactly. Prompt drainage and IV antibiotics.
Okay.
These abscesses can spread quickly and cause serious complications if they're not treated aggressively.
So we've talked about sinusitis and retropharyngeal abscess as potential complications of rhinitis and pharyngitis.
Yay.
What about tonsillitis? What can go wrong if it's not managed properly?
Well, as we mentioned, obstructive sleep apnea is a concern, especially in children. Enlarged tonsils can partially block the airway during sleep, leading to pauses in breathing.
And that can disrupt sleep, lead to daytime sleepiness,
Yeah.
and all sorts of other problems.
Exactly. And if the tonsillitis is caused by bacteria,
Yeah,
there's always that risk of the infection spreading.
like with the paratonsillar and retropharyngeal abscess.
Exactly. The infection can spread to nearby tissues or even into the bloodstream.
Okay.
That's why prompt treatment with antibiotics is crucial for bacterial tonsillitis.
And I'm guessing tonsillectomy is sometimes the answer. Surgical removal of the tonsils?
It can be, especially for recurrent or severe cases. Tonsillectomy is a common procedure, but it's still surgery.
Right.
So there are risks and potential complications.
We need to weigh the benefits and risks carefully. Now, what about laryngitis? We talked about how it can be caused by viruses, overuse irritants, even acid reflux. Can laryngitis lead to any long-term problems?
If laryngitis becomes chronic, meaning the inflammation doesn't go away,
Right.
it can damage the vocal cords.
So more than just losing your voice for a few days?
Right. Chronic laryngitis can lead to nodules or polyps on the vocal cords.
Nodules or polyps?
Yeah. Which are small growths that can affect the voice.
I'm guessing those can make it tough to speak or sing clearly.
Absolutely. They can cause hoarseness,
Yeah.
a breathy voice, and even voice fatigue.
Okay.
Sometimes voice therapy or surgery is needed to address those issues.
So that's definitely something we should be aware of. We've covered a lot of ground here when it comes to the potential complications of URTIs.
Yeah.
But as nursing students, we also need to understand how to manage these conditions
Yeah,
and provide the best possible care to our patients.
I agree. Let's shift gears and talk about some specific nursing considerations for each of these URTIs, because you're going to be on the front lines putting that textbook knowledge into action.
Sounds good to me.
Yeah.
So let's start with rhinitis. Besides educating patients about trigger avoidance, what are some other things we can do to help them feel better?
Comfort measures are essential.
Okay.
Think warm compresses for facial pain, saline nasal sprays to rinse out those nasal passages, and encouraging plenty of fluids to stay hydrated.
All of those sound pretty basic,
Yeah.
but I bet they make a big difference for someone who's miserable.
They do. It's about showing empathy and providing holistic care.
Yeah.
And don't forget to teach patients how to use those nasal sprays correctly.
Oh, right. Because spraying that stuff up your nose the wrong way can be pretty unpleasant.
And ineffective.
Exactly. A little coaching can go a long way.
Mhm.
Now, with pharyngitis, especially if we suspect strep throat, we need to be extra careful about infection control. Speaking of contagion, I'm thinking about patient education. How do we emphasize to patients that they need to stay home when they have strep throat to prevent spreading it?
That's a great point. We need to explain to patients that strep throat is highly contagious, and staying home is the best way to protect others.
Okay.
We can also emphasize good hand hygiene, covering coughs and sneezes,
Right.
and avoiding close contact with others.
So it's not just about treating the individual patient, but protecting public health as well.
Yeah.
Now, when it comes to tonsillitis, pain management is a top priority,
Yeah.
right? Because those swollen tonsils can be so painful.
You're absolutely right. Ice chips. Cold drinks, over-the-counter pain relievers, like acetaminophen or ibuprofen,
Okay.
are all good options,
Mm-hmm.
and encouraging gargling with warm salt water can soothe the throat.
I remember my grandma used to swear by warm saltwater gargles for any kind of sore throat.
There's a reason those home remedies have been around for so long.
Yeah.
They often work. And if a patient's having difficulty swallowing,
Hmm.
we need to watch their food and fluid intake to prevent dehydration.
That's a good point.
Yeah.
It's easier to forget about basic needs like nutrition and hydration when you're feeling that lousy.
You're right. And if the tonsils are so swollen that they're obstructing breathing,
Yeah.
we might need to consider supplemental oxygen or even more aggressive interventions.
Okay, let's move on to the big one. We've been talking about peritonsillar abscess. We talked about the importance of recognizing the signs and symptoms early on.
Right.
But what specific nursing interventions are involved in caring for these patients?
Well, first and foremost, we need to monitor their airway closely. They might need supplemental oxygen.
Mm.
And in severe cases, they might even require intubation.
Intubation.
Thanks.
That sounds intense. I remember learning about that procedure, but it's definitely not something I'm looking forward to doing in real life.
It can be challenging, but it's necessary if the airway's compromised.
Right.
We also need to monitor their vital signs,
Okay.
especially temperature and heart rate, to watch for signs of sepsis.
Speaking of sepsis, that's one of those complications we need to be extra vigilant about. What are the criteria we should be looking for?
Great question. Sepsis is a life-threatening response to infection. You want to look for a combination of things.
Okay.
Fever, rapid heart rate, rapid breathing confusion.
Okay.
It's essential to recognize these signs early and notify the doctor immediately.
Got it. So close monitoring, airway support,
Yeah.
and probably IV antibiotics are all key interventions.
You got it. And after the abscess is drained, we need to keep the area clean and watch for any bleeding or infection.
So it sounds like a lot of hands-on care and close observation.
Right.
Definitely not something to take lightly.
No.
All right, now for laryngitis, our focus is on promoting voice rest and hydration,
Yeah.
which again can be a challenge for nurses.
I know.
We rely on our voices to communicate. What are some strategies we can use to rest our voices while still providing effective care?
We can try to use other ways to communicate, like writing or gestures.
Well.
We can advocate for voice amplification devices
Oh, yeah.
for nurses who are experiencing laryngitis
Good idea.
and encourage patients to humidify the air.
Right, because dry air can irritate those vocal cords.
Exactly. So we've talked a lot about managing these various URTIs,
Mhm.
but I'm curious, what are some challenges you've encountered in your own practice?
Well, one of the biggest challenges I've seen is patient compliance.
I hear you on that.
Sometimes patients don't take their meds as prescribed,
Yeah.
or they don't follow our recommendations for rest and hydration.
It can be frustrating.
It is. It's frustrating because, it could really help them recover. What are some strategies we can use to improve patient compliance?
Communication is key.
Okay.
We need to explain things in a way patients can understand and make sure they feel heard and respected.
Yeah.
We can also involve them in the decision-making process and empower them to take an active role in their care.
Sometimes patients just don't grasp the seriousness of these conditions or the potential consequences. How can we emphasize the importance of following our advice without scaring them?
That's a tough one. We need to be honest about the risks,
Yeah.
but also reassuring and supportive.
Okay.
We can use visual aids, provide written instructions, encourage them to ask questions. It's all about building trust and rapport.
That makes sense. It's not just about giving orders. It's about working with our patients. Now, I know you're a wealth of knowledge when it comes to URTIs, but is there anything you've learned from your patients?
Oh, absolutely.
Any pearls of wisdom they've shared?
I've learned so much from my patients.
Okay.
I've learned that listening is just as important as any medical intervention. I've learned that empathy can be a powerful healer.
That's beautiful. It's a good reminder that nursing is about so much more than just meds and procedures.
It really is. It's about connecting with our patients, understanding their needs,
Yeah.
advocating for their well-being.
Well said. Now, before we move on, I want to circle back to something you mentioned,
Okay.
the importance of recognizing those early warning signs. Can you give us a few specific examples? What would those red flags look like in practice?
Sure. So let's say you have a patient with rhinitis
Okay.
and their symptoms are getting worse, or they develop a high fever. That could be a sign of a bacterial infection like sinusitis.
Okay, so watch out for those worsening symptoms and fever. What about with pharyngitis?
If a patient with pharyngitis has a sore throat that's so severe they can barely swallow,
Hmm.
or they develop difficulty breathing, that's a major red flag. Could be a peritonsillar abscess or another serious complication.
Got it. What about for tonsillitis?
Similar to pharyngitis, if the tonsils are so swollen they're obstructing breathing,
Okay.
or if the patient develops a very high fever, or other signs of systemic illness, that's a sign that something more serious might be going on.
So it's all about looking for those signs that the infection is spreading or that the patient's condition is getting worse.
Exactly. And with laryngitis, if the hoarseness persists for more than a couple of weeks,
Okay.
or the patient develops other symptoms like difficulty breathing or swallowing, that could be a sign of a more serious underlying condition.
So never hesitate to escalate your concerns or seek a second opinion if you're worried about a patient.
Absolutely. It's always better to err on the side of caution.
Well, I think we've covered just about everything there is to know about URTIs.
I think so.
From those everyday sniffles to those more serious situations.
We've covered a lot of ground today.
We have.
But the key takeaway for you future nurses is you'll be playing a crucial role in assessing, managing, and educating patients about URTIs.
Right.
You'll be putting all that knowledge you've gained in nursing school into practice, using your critical thinking skills, advocating for your patients.
This deep dive has given us a solid foundation. And now for the final part of our deep dive. We'll be focusing on the bigger picture. How we as nurses can advocate for policies and practices that prioritize the prevention and early detection of URTIs.
That's a great segue, because nursing isn't just about treating individual patients.
Right.
It's also about promoting public health and advocating for system-level changes that can improve the well-being of entire communities.
All right, so welcome back to our final part of our URTI deep dive. I feel like we've covered it all. Anatomy, antibiotics.
Yeah.
Everyday sniffles. To those moments,
Yeah.
the ones that really require some quick thinking and action.
We've been through a lot.
We have.
Yeah.
But for this last part, we're going to shift gears.
Okay.
We're going from the individual patient to that bigger picture,
Right.
public health.
Love it.
So we've talked about how common URTIs are
Right.
and how easily they can spread. This makes them a prime target for prevention.
Absolutely.
And as future nurses, we're not just caregivers.
Right.
We are advocates
Yeah.
for our patients and communities. So how can we champion those policies and practices that put URTI prevention front and center?
It starts with education.
Okay.
We have to be the ones who know the facts so we can educate our patients, our colleagues, our communities
Right.
about the impact of URTIs and what we can do to prevent them.
So back to the basics. Hand washing,
Yes.
covering those coughs and sneezes, staying home when we're sick, all that good stuff. Our moms drilled it into us.
Absolutely. Those small actions make a huge difference in breaking that chain of transmission.
Right.
And as healthcare providers, we need to be role models for these healthy habits.
We are walking billboards for good hygiene.
Exactly.
But beyond those individual actions, what kind of policies can we really advocate for?
One crucial area is vaccination.
Oh, yeah.
We know that vaccines are super effective at preventing many URTIs, especially the flu and pneumococcal disease. So we have to be strong advocates for vaccination programs.
Especially for us healthcare workers.
Right.
Right? We're at such high risk of exposure.
Yeah.
Advocating for mandatory flu shots for all healthcare personnel seems like a no-brainer to me.
It's a complex issue, but it's definitely something worth discussing and advocating for.
For sure. What about paid sick leave?
Oh, that's a big one.
Why is paid sick leave so important for preventing URTIs?
Because when people can't afford to take time off work when they're sick,
Yeah.
they're more likely to go to work sick and spread those germs.
Oh, for sure. Especially in healthcare settings.
Yeah.
We're around vulnerable patients all the time.
Exactly. Advocating for policies that support paid sick leave.
Right.
Not just for us healthcare workers, but for everyone.
Yeah.
Can really make a difference.
And then there's the issue of access to healthcare.
Oh, huge.
Early detection and treatment are crucial.
Absolutely.
So advocating for affordable and accessible healthcare for all is essential.
100%. Especially for those who are uninsured or underinsured.
It's about addressing those social determinants of health
Yeah,
that can really make it hard for people to stay healthy.
it is.
So we've talked about prevention. What about that early detection piece?
Early detection is key.
Yeah.
To preventing those complications we talked about, we can advocate for better access to diagnostic testing, especially in underserved communities,
Yeah.
to make sure infections are caught and treated quickly.
And that might mean advocating for more funding for community health clinics,
Exactly.
mobile testing units.
It's about being creative
Yeah.
and finding solutions. to get rid of those barriers to care.
As nurses, we see those barriers firsthand.
We do.
We have a responsibility to speak up.
And advocate for change.
Exactly. Your voice matters.
It does.
Advocating for prevention and early detection isn't just about one patient.
It's about our communities.
It's about a healthier future for all of us. This has been incredible.
It has.
Our URTI deep dive. We've gone from those little details to those big public health questions.
Yeah, I hope this has been helpful.
It has.
I hope you all feel more prepared to tackle those URTIs you'll see out there on the wards.
I know I do. And I'm leaving with a renewed sense of purpose. It's not just about caring for individual patients. It's about advocating for those policies that promote health and well-being for everyone.
Absolutely. That's the spirit.
Nursing is more than a job. It's a calling.
Couldn't agree more.
It's a chance to make a real difference.
It is.
And to all our fellow nursing students out there, keep learning.
Yeah.
Keep asking questions.
Keep advocating.
You're the future of healthcare.
We believe in you.
Thanks for joining us on our URTI deep dive.
You see.
Until next time, be well and stay curious.